Hello?
I'm calling with Equality Health. I'm one of the providers. My name is Dyer. You got tested June 27th.
Please leave a message and I'll call you back. Thanks.
I know we sound like a broken record, but it's really important to make sure we're enforcing this for everybody and having you all on the same page about what to do. Hello, my name is Dyer, and I'm a provider at Equality Health.
Oh, okay.
So I'm reaching out to you to let you know that you actually did test positive for COVID-19.
Okay.
So my big question right now is, are you having any symptoms? And if so, what kind of symptoms are you having at this moment?
How many calls like these are you doing on average every day?
You could do up to even 100 plus in a day. You really could.
As a family nurse practitioner, Dyer isn't used to spending her days on the phone.
Don't be mad at me, but I'm going to recite what I'm going to recite to every single soul. Okay, which is, of course, wash your hands frequently. Ideally, do not go into crowded spaces.
She's not used to fighting an epidemic of misinformation either.
There's this new undercurrent where it's making it harder, I think, for people to take the information seriously, because now some of that information is being taken almost more as a political opinion than a true medical recommendation.
It's such a bizarre time in medicine and in politics and in culture. What does it feel like to be wearing that robe right now?
Truthfully, I would have to say that this would have to be the most emotionally difficult time, I think, for anybody in healthcare, because there is risk associated now with going to work. There is that potential of bringing something home to other people that you love.
Dyer works with her patients to come up with a plan of action. But it's hard to give medical advice when federal and state guidelines keep changing, when masks aren't enforced statewide, and when testing can't keep up with the demand.
How are you guys doing?
We've already processed about 419 people.
No, you're lying.
Yeah.
Are you serious?
Yeah.
You're lying.
Yeah, so
419? We're going to have more losses because while we're over here debating what the government has done, or we're debating people who wear masks versus the people who don't, people are dying alone in the hospital, in the ICUs. Those beds are getting filled up rapidly.
Do you ever worry about your own health or your family's health?
I do. I have underlying health issues, and I'm still working. But we all do that. We all have to work. We all have to provide. We all still have to be functional members of this society.
Bye, you guys.
Have a good day.
The virus hasn't infected Dyer's home yet, but the ramifications have. She and her husband are both essential workers, making it that much harder to maintain a sense of normalcy for their 3-year-old daughter.
Doing this new routine, it's like this new dance for the family. You get home, very first thing you do is you take off all your scrubs and, you wash them, you clean them. In the beginning, she used to look at me like, why are you running away from me? And I kept thinking, oh, this poor kid. I think it is very easy sometimes for people to lose sight of the fact that we do have families, that we are still making sacrifices. There was a time period when all this began where I think my one comfort is I almost felt a little bit invincible.
Has that changed now?
Yeah, it's changed now. I kind of tell my husband, I said, I guess we're just working until we get sick.
I think we're just on autopilot, to be honest.
But that's exhausting.
You start feeling like you have to make preparations that you never really thought about before. Like, are we okay financially? What happens if, one of us passes away? What happens if both of us passes away? Who's going to watch after our child? I sometimes am afraid to allow myself to get too emotional about it.
Why?
Because I'm afraid that once that happens, it's going to be really hard to contain. It's hard, sometimes being a frontline worker, the hardest thing is you have to have this level of strength just to keep going, keep doing this, because people are relying on you to be strong.